All right, so today we're going to do a deep dive into something that I know you specifically are interested in.
Okay.
You sent us a bunch of information
Yeah.
all about cholesterol, and specifically about statins and their possible connection to cataracts.
Right.
Or Grauer star, as it's sometimes called.
Uh-huh.
And you're also interested in understanding some of the alternative ways to manage your cholesterol that your sources highlight.
Yeah, that's right.
And so that's exactly what we're going to unpack together.
Okay, sounds good.
So it's a big deal, right? Because statins are so commonly prescribed
Exactly.
for managing high cholesterol.
Yeah.
And like you said, you kind of want to look beyond the, well-established benefits to some of the maybe less discussed aspects of it.
Right. Yeah, I mean, there's always more to the story, and I think you're interested in kind of getting into some of the details there.
Totally. And so in this deep dive, we really want to kind of dissect the evidence that your material presented on the potential link between statins and cataracts and try to understand the arguments around that.
Yeah.
And then also discuss the alternative strategies that you highlighted.
All right, let's jump in.
For managing your cholesterol.
Yeah, let's do it.
Okay, so let's get right to it.
Okay.
The core issue here is this idea that statins could increase the risk of cataracts.
Right.
One of the pieces you shared, it's in German.
Okay.
It states pretty directly that scientific studies show that statins can increase the risk of cataracts significantly. And it goes on to say that while statins are like the go-to in conventional medicine for treating high cholesterol, they come with a whole slew of side effects.
Yeah, that's true.
Some of them pretty serious, like esophageal cancer, liver, and kidney failure.
Wow.
Muscle weakness. And even potentially a connection to Alzheimer's.
Right.
And cataracts are specifically mentioned frequently as a potential side effect.
Yeah, I mean, it's interesting how the source kind of frames it, too. Like, they describe cataracts as, like, a clouding of the lens in your eye.
Okay.
And that leads to your vision becoming weaker, more blurred. And it can even get to the point where you can only see, like, light and dark.
Oh, wow.
So they paint kind of a bleak picture.
Yeah.
But they do say that, from the standard medical perspective, that cataract surgery is a pretty routine procedure.
Okay, so this is like the counter argument.
Yeah.
Right, because it's treatable.
Right.
Through surgery. Some medical professionals might say, well, it's not a reason to not prescribe statins.
Exactly.
If they deem it necessary for managing high cholesterol.
Yeah, and I think that's where your source really pushes back and said, well, hold on a second. Maybe we should be looking at, what's causing this high cholesterol in the first place.
Right.
And addressing that through lifestyle and diet changes rather than just, artificially bringing the cholesterol down with medication.
Right, and not even addressing
exactly
the root cause.
Yeah, and they make the point that conventional medicine, doesn't really put enough emphasis on that.
Okay.
On recommending those changes.
Interesting. So it's really about, like, where's the focus?
Yeah.
In treating this.
Exactly.
Right.
Yeah.
Okay, so let's look at some of the research that's presented to support this potential link between statins and cataracts.
All right.
The source points to a study that was done by Dr. G.B. John Mancini and his team at the University of British Columbia. And they looked at a huge amount of data, over 1.3 million people. From databases in Canada and the U.S.
Okay.
And their approach was to look at people who had been taking statins for at least a year before they had their first eye exam.
Okay.
So that's an important distinction.
Yeah.
Right? They wanted to see, okay, what happens over time.
Right.
So what did they find?
Well, they found that the people taking statins in the Canadian database had a 27% increased risk of developing cataracts.
Wow,
which is pretty significant.
That's huge.
Yeah, it was lower in the U.S. database.
Okay.
But it was still 7%.
Okay.
Which is still noteworthy.
Right.
And the fact that they were specifically looking at people who'd been on statins for at least a year, that suggests that maybe there's some sort of cumulative effect.
Right. Yeah, it's not just like an immediate thing.
Right.
And the source goes on to say that this isn't the only research that's out there suggesting this.
Right.
It also mentions a study by Jay Lucian and colleagues at the Wilfred Hall Ambulatory Surgery Center in Texas. And their research involved almost 14,000 patients.
Wow. Okay.
And they found an increased risk of cataracts in patients who had been taking statins for more than 90 days.
So a much shorter duration.
Yeah.
But the Canadian study.
Right. But still
significant.
Yeah.
What stands out to you from those findings?
Well, I think the fact that you have these multiple studies,
Yeah.
right, from different places,
Yeah.
using different methodology,
Exactly.
but they're all kind of pointing us the same direction.
Yeah, and the researchers in the Texas study actually recommended that doctors should really think carefully about how necessary statin use is.
Right.
And that really echoes what the source, the main argument in the source you shared.
Totally. And this kind of leads us to another thread of this argument,
Okay.
which is the pharmaceutical industry's influence.
Right.
The source suggests that there's a lot of pressure on doctors to prescribe more medication, and that the target levels for what's considered high cholesterol are constantly being lowered.
Oh, interesting.
So the implication is that this could lead to more people being classified as having high cholesterol and therefore becoming candidates for statin treatment.
Right. So it's like almost creating a market.
Yeah, and this brings in like a socioeconomic angle
to
this whole discussion.
Absolutely. I mean, if you think about the larger picture here,
Right.
the source is kind of hinting that, the focus might be too much on medication as like the main solution.
At the expense of lifestyle interventions.
Exactly. And it even goes further. It talks about a recommendation from the American College of Cardiology and the American Heart Association to consider statins for almost everyone over the age of 65.
Regardless of their cholesterol.
Regardless of their cholesterol level for preventing cardiovascular disease.
Interesting.
And the reasoning they give is that statins might help prevent cardiovascular issues even if your cholesterol isn't high.
So they're saying there's benefits beyond just lowering your lipids.
Exactly. And that's a really, that's a big statement.
It is a big statement.
Because it kind of implies that, the benefits of statins might go beyond just, their effect on lipids.
Right.
But it also raises questions about, what are the long-term effects?
Right. Are we looking at the whole picture?
Exactly.
Okay, so we've looked at the kind of the argument that statins might be linked to a higher risk of cataracts.
Right.
Now let's switch gears a little bit.
Okay.
And talk about those alternative ways to manage cholesterol that you are interested in.
Yeah.
The source really emphasizes this point that high cholesterol is often a result of diet and lifestyle. And that it could be effectively managed by making some relatively simple changes.
I think that's a crucial point because, the source is saying it doesn't have to be either you have a heart attack or you develop cataracts.
Right.
There's another way.
There's a third option.
Yeah, and they're advocating for, being proactive and making those lifestyle changes as the first step.
Before even thinking about medication.
Exactly.
So it's a more holistic approach.
Yeah, absolutely.
Okay, so what are these changes?
So they give a list of 10 key steps.
Okay.
For naturally lowering cholesterol.
All right, hit me.
The first one is reducing your intake of sugar and carbs.
Okay.
And they specifically say, avoid things like white flour products, white rice.
Right, the processed stuff.
Exactly.
Right.
And they even suggest konjac noodles.
Konjac noodles?
Yeah, as an alternative to like traditional pasta.
Interesting.
Yeah, and that actually ties into their next recommendation, which is increase your fiber intake.
Okay.
So they're saying, choose whole grains and incorporate things like psyllium husks.
Psyllium husks, okay.
Flax seeds, chia seeds,
okay.
coconut flour, konjac powder.
So fiber's really...
Yeah, fiber's a big one.
Okay.
The third point is about making healthy fat choices.
Okay.
And they really highlight omega-3 fatty acids.
Omega-3s.
As potentially being able to lower cholesterol.
Okay.
So they recommend using oils like linseed oil, hemp oil, krill oil.
Okay.
For cold dishes.
Okay.
And then ghee for cooking.
Okay.
And they suggest, fatty fish over fatty meats.
So it's all about the types of fats.
Yeah, it's all about the types of fats.
Not just.
Right. Not all fats are created equal.
Gotcha.
So the next few recommendations kind of focus on the gut vitamin D and some specific supplements.
Okay.
So they say, support your gut microbiome.
That's the good bacteria?
Exactly. The good bacteria in your gut by taking probiotics.
Probiotics, okay.
And they note that could potentially contribute to healthy cholesterol levels.
Okay.
They also advise checking your vitamin D levels, making sure you're getting enough.
Okay.
The deficiency might contribute to high cholesterol.
Interesting.
And they also mention chlorella supplementation.
Chlorella, okay.
Which is a type of algae
right.
that might have cholesterol-lowering effects.
Okay.
Moving on, they recommend including berries in your diet every day.
Berries, okay.
Specifically strawberries and blueberries
okay.
for their cholesterol-lowering properties.
Gotcha.
And then they advocate for adopting a predominantly alkaline diet.
Okay.
based on fresh, regional, organic foods.
So really clean.
Yeah, really clean eating.
Right.
And they suggest that this kind of diet can help prevent a variety of diseases. Including cardiovascular issues.
Okay.
And they briefly touch on the concept of alkaline foods.
Right. So they don't get too deep into that, but they just kind of
mention it.
Mention it. Okay.
And then the final 3 measures they list are prioritizing rest, stress reduction, increasing physical activity.
So these are all kind of like lifestyle.
Exactly. These are all lifestyle things that can impact your cardiovascular system.
Right.
And indirectly influence things like cholesterol.
Okay.
They also say avoid alcohol.
Okay.
Because it has multiple negative effects, potentially raising your cholesterol blood pressure.
Right. Alcohol's not good for you.
Not really.
In a lot of ways.
In a lot of ways.
And lastly, they mention an article that discusses alternative medicine treatments for vision problems, including cataracts.
All right. So they kind of point you in another direction if you're interested.
If you want to learn more.
Exactly.
Okay. So to sum it all up,
yeah,
we really dug into the information you provided.
We did.
Right. We looked at the argument that statins may be associated with a higher risk of cataracts.
Right. Yeah.
We talked about the studies that were cited.
The
potential influence of the pharmaceutical industry.
Yeah.
The widening guidelines for statin use.
Right.
And then we spent a lot of time talking about those 10 lifestyle and dietary changes as natural ways to manage cholesterol.
And I think it's important to say, we haven't taken a side here.
Right.
We haven't endorsed any particular viewpoint.
We're just trying to explain.
We're just trying to explain the content, the research that was cited, and the potential implications of all these arguments that were presented in your sources.
Exactly.
Yeah.
So with all of that in mind, here's a final thought for you.
Okay.
Next time you talk to your healthcare provider about your cholesterol, what are the most important questions you should be asking?
Yeah.
About the potential risks and benefits of different approaches.
Right.
Including both medication and lifestyle modifications.
Exactly.
Right. So really think about, what are the right questions to ask?
Yeah, because it's your health.
Yeah.
You're in charge.
Exactly.
And, keep doing your own research.
Right.
Think critically about all the information out there.
Absolutely. And thanks for joining us for this deep dive.
Thanks for listening.
We'll catch you next time.
See ya.